Okay, I'm recording now. I am going to do a little screen share because I wanted to show everybody this website that I use for balancing calories for our overweight patients. And I am going to talk about dogs today, and I'll do another one for cats if anybody is interested in that. So I'm going to just share my screen here. And let's share this one and see if this works. Aha. So I am currently sharing this website. It's Pet Nutrition Alliance. And what I wanted to show you was this calculator here. So you can click calculator or calculator here. So we're going to go to dogs. And on this, you're going to enter your pet weight. So you could see that I was playing around with it. So my example was, what did I say? Oh yeah, I was going to say my patient was 38 kilograms. Now remember, I'm in Canada and I'm going to talk in kilos, but if you're in the States, you might be talking in pounds. And of course, there are some people that weigh their dogs in pounds as well in Canada, but all of our medications are dosed on kilograms as well as the calculations that we use. So if you have a 38 kilogram dog and your veterinarian has said that your dog is a little bit overweight, and often we will see, let's say, the dog that's 20% overweight. So you can see that I've given this dog a body condition score of 7 out of 9. And that ends up being 20% overweight with an ideal body weight. So your standard lab should be, around 30 kilos for most females. Even that's a little bit high sometimes. And then it's currently spayed or neutered. That's a little bit of a calculation because if you have an intact male or female dog, they're going to expend more calories just on the fact that they will be cycling or using their hormones. After you've done that, you can see that the estimated calories that your dog should eat is 847. And if you are a veterinarian or a vet student, you know that your dog can also eat 10% of those calories in treats. So just to keep that in mind, that treats are human food, any of those treats that you purchase from the pet store, anything that's basically extra, the table scraps, etc. And then this part where it says food, this is your well-balanced diet. So anything that's sort of labeled to be balanced for your pet. After you've done that, you can go on to the food tab here. And we're going to say that the food that we are currently feeding is 375 kilocalories per cup. Now, calories and kilocalories can be interchangeable. So keep that in mind that if you're typing this out, if you've taken it off of a website or if you've taken it off of the package that you have of your pet food, it might be saying kilocalories, but this is the same as calories here. So if my food is 375 kilocalories per cup, and my dog is roughly 20% overweight with an ideal body weight of 30.4 kilograms, I'm feeding 847, which means that I'm going to feed about 2 cups of this particular food per day. Now you can do a search of the brand that you're feeding and it'll come up with some websites and that sort of information you can put here if you want. So you can certainly write that in there. but I like this for clients. So I click the report, type the office name, office phone number, the pet's name. I usually reweigh after 1 month. And then after 2 months, I just want to make sure that they're trending in this direction. And then I hit print and I save that as a PDF. So if you look here, it'll come up with the pet's name, the date that we've done that, the current body weight, the body condition score, that my pet is 20% overweight, and this is their estimated, like their goal weight. And you'll see the number of recommendations. So I like to use email, so I'll save that and we'll email that to a client. And then they have that as sort of a tracker, so they know how much they've fed their pet, making sure that they're going towards their ideal body weight. So how do you determine the body condition score of your pet? So if you haven't taken your pet to your vet for a while, just know that your veterinarian will weigh your pet on the way in, but then we put our hands on your pet and we give them a body condition score. So we'll be feeling over the point of the shoulder, the like scapula or the shoulder blade. We'll feel across the ribs. We'll feel the loin or slightly like lower back and over the pelvis, and give them sort of a body condition score. When we do our abdominal palpation, we can get an idea of how much intra-abdominal fat, because there's a lot of fat on the inside of the body that we can't feel on the outside, because the outside you just feel the subcutaneous fat. And then keeping in mind that you also have fat in your mediastinums, the space between your lungs. So why is that important to know? So we obviously understand in veterinary medicine that a lot of pets come in obese, and it comes down to the amount of food that they're eating. Whereas a lot of people during COVID, they might say, you know what, we just haven't gotten out very much because of COVID. They're putting on the pounds because of that. But only 20% of their calories can be changed by increasing their activity level. And 80% of that is through the amount of food that they eat. And that's the same with people. So if you're looking to lose your COVID weight, you need to eat less, and your dog also needs to eat less. And so it's important for our Labrador Retriever that we've been discussing as our example here, because they are more predisposed to getting some joint disease. We want to make sure that they're not getting obese and leading to diabetes. And that if they do have any joint disease, say their knees or their hips, we don't want them carrying around that extra weight and putting pressure on those joints. For those small dogs, let's say our Yorkshire Terriers or our Pomeranians, a lot of them can get collapsing trachea. And so that mediastinum, or the space between their lungs and around their heart, gets full of fat, and then that pushes on their airway. And so then that can cause an increase in coughing and pressure on their trachea and causing additional collapse. You might have say a doxy. We don't want those doxies to be overweight, because they can get intervertebral disc disease, and then they're carrying around a bunch of extra weight on putting pressure on their back. So definitely things to keep in mind. So on here, there's a half point as well. So if we're like, oh, you're 15% overweight, that puts you here. You're going to be having a goal weight of 32. So there's also this body condition score chart. So if you're at home and you're wondering, oh, I want to be able to do this myself, you're going to click on this body condition score chart. It's going to bring you up to the WASAVA nutrition body score. So again, you're marking where you are on the chart, or I should say where your dog is on the chart. 4 to 5 is considered ideal. We can expand this so you can actually see it on the screen. And for some reason, these photos didn't load properly, but that's okay because I have them open over here. There's your 4 to 5 is our deal. So I like the sport dogs to be in that 4 range. So sport dogs, like your visualize, I want them around in the 4. A lot of those labs, those family dogs, we want them around the 5 mark. I said my dog in the example was a 7. So take a look at this sort of body condition. So when you're reading a 7, the ribs are palpable with difficulty. So you have to kind of like put a little bit of pressure. There's a heavy fat cover, noticeable fat deposits over the lumbar area and the base of the tail. And their waist is absent, so or barely visible. So when you're looking above, there's barely a waist here, whereas this one has sort of a little hourglass shape. So you want to be able to see the waist, and you also want to be able to see this abdominal tuck. And a lot of the dogs that are coming in, they're kind of in this area. I shouldn't say a lot of them are a 9. A lot of cats are 9 and above, but dogs, they're probably around here. 7, I give a lot of body condition score of 7. Very few are down here. Malnutrition, when they're on the street or street dogs, you might see them, or they're have a lot of parasites, they might be down here. But this is the area that we want to be. And then keep in mind that not all diets are treated the same. If you're looking for your pet to lose weight, you do not want them to just reduce the food that they're eating if they are being fed just a standard diet. You want to choose one that actually has weight control or weight loss or something like that, healthy weight, something like that written on the packaging, because that means that it's still balanced with the vitamins and the minerals that are necessary. So you don't just want to go to the store and say, oh, this 400 kilocalorie cup per cup, I'm just going to reduce the number of cups. You don't want to do that, because then you could actually be giving them fewer nutrients, so fewer minerals and vitamins per cup for their day. So you want to make sure that you're feeling something that is labeled for weight control or weight loss if you are looking for your dog to lose some weight. So that's sort of important as well. Where did you go? It's underneath here somewhere. So the reason that I got onto this website was actually because of the, go back, was because of this Dare to Ask nutritional comparison. So on my next video, I'll show you this one. But again, if you have a dog, or if you have a cat, and these are adult dogs and adult cats, there's a different formula if you have a puppy. So just make sure that you're using this if your dog is older than 1 year, is a fully grown and adult dog. And this is for healthy animals, so not for sick pets, because they're going to have different nutritional requirements. So if you have any questions, just leave a little comment and share around if you or your friends have an obese dog. And thanks for watching.